Thanks, Michelle. Hi, everybody. My name's Whitney, and I'm going to try to share my screen here. I'm located in Chicago. All right. Michelle, can we see the screen okay?
Yep.
Yeah? Okay, thanks. All right. So, yeah, I come to you from Chicago. Really happy to be here today. And I'm going to talk about my experience working in behavioral health as a full-time yoga therapist. So I'll go into kind of my background, where I work now, what that level of care means, the challenges and kind of learning curves I've had along the way, as well as the rewards that are equal to those challenges. So, my kind of background and personal journey has been dealing with chronic pain since I was like 16, and the intersection of chronic pain and mental health. That's what brought me to yoga therapy initially, to Inner Peace's program, and it continues to be what informs my work moving forward and what brought me into trauma recovery work as well. I graduated from Inner Peace in 2018. I've been teaching yoga in the Chicago area since 2012. And I'm currently a student of somatic experiencing. That's Peter Levine's work. It's through SE International, and I'm in my intermediate year there, which means that I'm already integrating it with yoga therapy, but I won't be certified until probably early 2028. Professionally, I've worked at a variety of levels of care. Before I was in treatment centers, I worked outpatient, private practice. I'm sure many of you do that or have some experience with it. I ran my own small business. I saw clients individually. And my focus at that time tended to be mostly clientele that were looking for um, chronic pain management, also stress management, and they are, of course, connected, and functional mobility and just a little bit more ease in the day to day. So I ended up seeing a lot of clients with spinal conditions, joint injuries and joint replacements, and chronic illnesses. And then I started moving into treatment and recovery centers. And I really appreciate everything that Janet said about like getting your foot in the door and how to like network and I don't know, start making yourself known in these spaces. How it happened for me was that I was teaching yoga and involved in a training program that was a partnership with a psychotherapy practice. So it's yoga and psychotherapy. And so I was recruited there by a company that was opening up a recovery center. Once I started working there, I began networking. So I worked at three different recovery centers, and I'll get into where I'm at now and what I'm doing there. But they have been PHP and IOP levels. I'll get into what that means as well as residential and the different demographics and areas of treatment focus at these centers have been for both adolescents and adults. Right now, I only work with 18 and over, but I did work with adolescents at a previous treatment center. Complex trauma, eating disorders, mood disorders, and substance use disorder. And that brings me to where I am now. So I work at Skyway Behavioral Health. This is in Skokie, which is just outside of Chicago. And I work there, as Michelle mentioned, full time. So I'm a salaried on staff employee. I'm there Monday through Friday from 9 to 5 ish. And I started working there because of a different Inner Peace grad, Jenna Shant. Absolutely need to give a big shout out to Jenna. Um, they were part of the opening of this facility 4 years ago and basically created a somatic program. So the somatic program includes yoga therapy. It includes psychoeducation, a lot of it on like trauma and the nervous system and why we do body-based work. and a few other little pieces in there as well that are led in different groups for the clients. So they laid the groundwork, and they hired me a little bit over a year ago. And then there's also another location. This was the first location that Skyway opened. There's another one in a different suburb, and another Inner Peace grad works there as the primary yoga therapist, Teresa Dufare. So what's nice is that although we're part of this larger like conglomerate, that Teresa and Jenna and myself have our own department. And that's a new thing for me because with independent contracting, I was going by myself from place to place. And of course, I was communicating as best as possible with the other clinicians. But to have a yoga therapy department has felt really supportive because we can bounce ideas off of each other. We can consult with each other. And it's a really big chunk of the programming that we have. So the programming itself, right? I mentioned PHP IOP level of care. This stands for PHP is Partial Hospitalization Program. Those clients are with us from 9 a.m. to about 3:30 p.m. Monday through Friday. So we are not open on the weekends. For like PHP level of care is going to be business hours. And the IOP level stands for intensive outpatient. And that usually happens after a client steps down from PHP. So if we're looking at kind of like levels of care for mental and behavioral health, inpatient hospitalization would be the highest level of care, then residential, then PHP, so like pretty much full days, then IOP, half days. So those clients are with us either 9 to 12 or 12 to 3. And our IOP program is Monday through Thursday, and clients will generally then taper down as their treatment goes on and as they prepare for discharge. And I think for many clients, it's very supportive to have kind of a tapered down programming style where they can gradually start to move back into daily activities, jobs, et cetera, et cetera. We are an 18 and over facility. That means we do have some adolescents. We have a good chunk of clientele that are 18, 19, 20, 21. I would say that most of our clients are 20s, 30s, 40s. And we do have clients, I would say, up into their 70s, right? Not as common, but we serve anyone over the age of 18. And we do have an accessible facility as well. On top of that, we are a full fidelity DBT facility. DBT means dialectic behavioral therapy. It's Marsha Linehan's work. And I started learning about it quite a bit when I began working at Skyway. That's actually one of the perks that I'll mention, that I get to learn a little bit more about other modalities and see how yoga can complement it so, so well. The demographic that we work with, I mentioned 18 and over, but we are treating complex trauma, which is kind of like an underlying cause for a lot of different things, right? That can be like the root for a lot. But complex trauma, eating disorders, mood disorders. What I want to kind of highlight is that we are not primary substance use. The last treatment center I worked at was actually the last two. And so the difference is that if clients come to us and they're in active addiction, which I want to name is very common with complex trauma. Substance use is very, very, very common. If they come to us and they get admitted and then it is discovered that they're in active addiction, that we are not the correct place for them, what we'll do is refer to a different program that has substance use as a primary focus. And then we'll invite them to come back to Skyway programming if it's appropriate for them once they have some type of stability in their own sobriety. So just naming how like the different focuses can kind of branch off. And when you work in mental health, there's a lot of overlapping diagnoses and overlapping conditions. But ours will be, again, complex trauma, eating disorders, and mood disorders. With that, we have 7 different tracks that clients go on. So once they get admitted, for PHP level, we have 4 different tracks. And for IOP, we have 3 different tracks. As a yoga therapist there, as the primary yoga therapist, I am seeing every client that walks in the door. And that's really exciting for me in some ways. Like, that's so great. I get to encounter everyone there, and everyone has an opportunity to practice yoga and learn about how the body and the nervous system are affected with trauma, as well as the mind, how it all goes together. It's also a lot of nervous systems every week. So it is a both and. It's a privilege and it's hard work. And so within those 7 tracks, I lead 16 yoga therapy groups every week. The clients that are at the PHP level of care have 3 yoga therapy groups every week. I want to name that as another bonus of being kind of integrated into the general programming. We are mostly a group therapy facility, and the clients have one-on-one therapy twice a week. But with these PHP clients, seeing them 3 times a week, I get to build rapport. I get to also see how the progress unfolds much more than like when I was working outpatient, I would see clients usually once a week. I will say once they step down to IOP, it's once or twice a week groups, depending on what track they're in. Then on top of that, I lead 1 psychoeducation group a week. The clients have more than 1, but I only lead 1 of them a week. We have some other clinicians that lead those as well. And that's a really, really important part of this program. I know Janet spoke a lot about like clinical language and communication, and I want to touch on that a little bit too. But before I get into that, actually, I'm tangenting a bit. Back to the psychoeducation groups, we're providing the clients with the why behind the yoga therapy groups. Why is the nervous system affected in this way? What can we do about it? And that's really great because it helps with the buy-in. I will say we're an elective program, like we're adult program. So when clients come to us, it is voluntary. And if they wanted to come to the yoga group and completely check out, they can. And that does happen because there are different levels of capacity and we're kind of crisis level care. But because we have the psychoeducation piece to tell them, hey, this is why we're doing it, people are much, much more open to yoga. They also often will, when they admit they're brand new to program, will hear the word yoga and will say before they meet me or come to group, they'll tell their case manager that's like giving them a tour, I can't go to yoga. I can't do that. I'm not flexible. I can't sit on the ground, et cetera, et cetera, et cetera. And once they learn about what we're actually doing, I would say 9 times out of 10 clients are much more open to it. We do have a room for yoga, so I don't have to move things around too much. I'm very lucky. We have like all of the mats, all of the props there. We have chairs for folks. So everything that I offer in the groups can be accessible on the chair or on the floor. We have bolsters, blocks, and blankets as well. So that's kind of the groups. I guess one more thing I want to say about that is the group size. That depends on the track. I mentioned there's 7 tracks. They can't be bigger than 18, and it's rare that we have 18 people in a track. Most of my groups are around 10 people. Then on top of the groups for yoga and psychoeducation, I see 3 individual clients weekly. And those clients I see on a case-by-case basis. So their primary therapist will talk to me if they think that this client is a good candidate for one-on-one work for a variety of reasons. And they'll submit them to, we usually have a waiting list to work one-on-one. And then I will see clients once a week if I'm working with them individually for their duration of PHP. So when they step down to IOP, then one-on-one yoga therapy is no longer available for our programming. But we encourage like outpatient referrals and definitely encourage continued somatic work for the vast majority of the clients. What else did I want to say about individual client work? I mentioned the wait list. A lot of people will come to our program because we have somatic treatment. And again, I'm using the word somatic because it's an umbrella. Body-based work, yoga is underneath it. And in a clinical setting, somatic, as we know, is like very buzzword right now, but it tends to be a little bit more received sometimes than the word yoga. So we do get a number of clients that come to Skyway specifically for that. And I wanted to highlight that today because of possible imposter syndrome, because we're not licensed, because it can be challenging to get a foot in the door. All of that might be true, and studies are coming out. Things are changing, especially in trauma work. The scientific community and the medical community are gaining more evidence that yoga is widely beneficial. So hopefully that's motivational in some way, right? We definitely have a place in this work. So those are all of my clinical hours. I've got the groups and the clients. And then on top of that, because I am full-time, I attend the weekly meetings, staffing, consult, and DBT teams. Staffing is kind of like rounds. We kind of just go over all the clients very quickly, and I rotate which track I go to for that. With consults, we consult, right, with each other. So that is track specific. Again, I rotate, but let's say I have a client on a specific track, I will attend their consult, and then I get to share what I'm working on. I get to collaborate with the primary therapist, the whole team of group therapists, and the psych nurse practitioner. We have medication management as well. So we all get to share ideas. And if I don't maybe have an individual client on that track, it is still very, very useful for me to go to consult and to hear. And this is where this is a difference for me from like independent contracting work to salaried work, is that I get to hear what's going on in the milieu. And milieu is kind of the word for the group of clients that are in a track at any specific time. That's what they're called. And you'll hear that in like different mental health settings. So I get a lot of info from that. That helps me out. And then we have DBT teams, and that is just another staff meeting where the clinicians can go and support each other. So that's something else that I appreciate about this work. I have weekly supervision, and although we are not licensed, I'm not getting, clinical hours for that. It is still very, very valuable to get to share what I'm doing with my clients, to receive feedback, and to ask for guidance. And of course, there's documentation. And Janet spoke to documentation a little bit. That's another part of my job description. And it was a little bit of a learning curve too. I'm going to talk about that on the next slide. Okay, so navigating this system. So now that I'm at Skyway, part of kind of a bigger framework, and there were some learning curves. Additionally, when I was deciding what to talk about today, I was like, oh, challenges and rewards. And then I thought to myself, those challenges have been very, very, very valuable, and I'm grateful for them. So I changed it to learning curves. So the big one was clinical language and clinical procedure. I'm not going to go too much into that. Really, really appreciate, Janet, what you said about saying balancing energy versus regulating autonomic nervous system. It's like that type of translation and learning to speak the language of the people that you're communicating with. So that's been really big, learning the trauma protocols and different treatment procedures, learning how to document for insurance purposes, practice your SOAP notes. all I can say. Practice your soap notes, practice clinical language. The more you do it, the easier it does get. And then also my scope of practice and my role inside the greater framework of Skyway programming. Not much I really want to say about this, just it has really solidified like what my lane is. And that is yoga philosophy and the lens of the nervous system. And I can go a long way with that too. I'll talk about that in a little bit. Those are the big learning curves. The rewards have been huge. I got to learn all those things above that I just listed. Client successes are very, very rewarding. And I feel like because yoga is embedded in the programming, that I am able to more effectively work with clients. I share my case notes. I have access to their portals, their assessments, their history. I see them in the groups every week. So once I start working individually with someone, I already have a little bit more information than I might have otherwise. And the client successes are, I don't know. It's why I do it. It's why I do it. We get clients that are with us sometimes for many, many months. And being able to see their shifts throughout that time is beautiful. And it's often very bittersweet then when a client discharges, because then there they go. So that's very different from outpatient. I don't get to keep working with these people. I'm with them for their stay, and then off they go to live their lives. So I have to remind myself a lot that we're planting seeds and we are not watching them grow, and that we have a robust referral list and just continue to encourage clients to explore their path. Another big reward of working inside of a larger system full time is the camaraderie and co-regulation that I receive as a clinician. I want to talk about burnout a little bit, but with the high rates and likelihood of burnout, not only in our culture, but in this level of mental health care, it is so very important to have the camaraderie, to have the support of others. And I found that to be probably one of the single most supportive qualities of working in this type of environment. We lean on each other, and that keeps us all going, because it can be really heavy sometimes. And we don't need to hold that on our own. We can hold that with each other. So advice, if you're working not as part of a larger framework, but if you're working independently, to build some type of network or community with other people that are doing similar work, so that you can have that camaraderie, and so you can share ideas with each other. Sometimes it's just like, ooh, that was a really tough session. Like, can you just sit with me for a minute? And that's highly valuable. I'm going to come back to unique lens of a yoga therapist and move down here to importance of burnout prevention, because this relates to the camaraderie and the co-regulation. I've had to really work on, and I continue to work on, tracking my own system when I'm doing this type of work. I mentioned I see all the clients that come in the door. It's a lot of clinical hours every week. There are expectations, and I need to show up. And the clients are often in pretty low places in their life. They're really struggling. That's why they come to us. So how can I hold all of that and continue to make it sustainable? Part of that is community. Part of that is tracking my own system when I am with clients and when I'm with groups. I encourage everyone to get curious about that too. What's going on inside your own body when you're holding space, and protecting energetic boundaries outside and inside the workplace. And that'll look different, depending on where you are. But with a corporation, anyone's ever worked for one before, they will ask you to do more work until you set a boundary. And so it's just important to do that, right? And it's normal to do that, and it's okay to do that, and it will make the work sustainable. Yeah. Burnout prevention is a big one. Um, I heard that the common like turnover rate for PHP level of mental health care is 2 years. I'm at a little over a year. I hope to stay much longer. But that was just something my coworker was telling me because it's you take into account the amount of work and then with complex trauma too, the secondhand trauma that we can experience from hearing stories, right? And lived experiences from our clients. Okay. Last piece here on navigating the system is remembering that we do offer a very unique lens as yoga therapists. We have the whole person assessment. We will often see things, catch things, observe things that other clinicians might not see. So remember that. Remember that we have a place in this system. We bring great value to it. And when I began getting a little bit more comfortable in this job and feeling like I could share my observations more and I could bring in a little bit more to like the consultations, I was met with a lot of gratitude because, again, it kind of rounds out the system of care that clients are being provided, and we cannot ignore the nervous system. And I just want to say thank you to people that have heavily influenced me and helped me get where I am. Michelle, thank you so much for everything that you do. Neil and Lisa Pearson, I use their chronic pain work quite a bit. Durga Leela and addiction recovery. Maria Shamus and functional movement and, tools for life. And Jenna Shant, who is my boss and supervisor at work, who created the somatic program at Skyway, along with many other people, right? But I'm going to leave it there and see if anyone has any questions. I don't see anything in the chat, so just want to open that up for the last 5 minutes here if anyone does have a question.
That was so great. Thank you, Whitney. And we'll take a few moments, take a little pause to see if folks do have questions. I have one, actually, and that is, how long are the groups? So 16 groups a week. I was trying to calculate like how many hours a day you were working. So tell us, how long are those groups? Do they vary?
Most of them are 1 hour. We have a few that are an hour 15, and we have one that's 50 minutes. So my weekly clinical hours are usually around 22, and that is on par with what the talk therapists are doing as well for clinical hours.
Would you might not know the answer to this, and you might not be willing to share, but I'm curious if you would be, and it's okay, of course, either way. But do you know how your salary might compare to a therapist in a different field in your hospital?
Yeah, actually, it's the same.
Mm-hmm.
It's the same as okay, so like the different like levels of therapists, basically, entry level, if you're working clinically, is primary therapist, primary clinician, and my salary is similar to everyone that's doing that role.
Wonderful.
Mm-hmm.
Yeah. Thank you. You want to address maybe the question in the chat from Danielle?
Yes, I'm just catching up on it. Okay. Any advice for how to approach a mental health facility about forming one? Yes. I have never created a program within PHP IOP, but I have like cold call places to kind of pitch to them as an independent contractor that I could provide services within their programs. And I was working on that before I got offered this position. So I, stopped that in its tracks. But my advice would be to put together to network first, to find some type of doorway in. It can be a friend of a friend, see where you know people, use LinkedIn, et cetera, et cetera. Use someone's name. Hey, I was referred to you through so and so. I got your email through so and so. Send the message. Keep it very brief up front. This is who I am. This is what I offer. If you're open to this, please contact me back. And then follow up with it. But that first message, I would say, keep it very brief and then be prepared to provide the why behind what you are offering. And you might find that as long as the budget is there, that I guess I should say, depending on where you are, but in the Chicago area, treatment centers are very, very open to yoga. They want it. And I think a lot of them, and the people that are like maybe in the like executive clinical leadership, need some more information about yoga therapy and how it can work in tandem with whatever else they're providing in a way that is safe for the clients. I know Janet mentioned like emphasis on safety. That's the big one. I would say something. I'm going to say something. I would say money's bigger than that to most of these places. Unfortunately, I think money comes first over client safety. That said, if they have the budget and you provide what it is that you do, I think you might be received and you might be positively surprised.
Awesome. Thank you, Whitney. I appreciate that. I live in a very rural area, and I don't think there's any programs closer than like 4.5 to 5 hours from where I live. It is mental health services are a desperate need in our community. And I think I have connections. Luckily, a lot of counselors come to my yoga therapy practices and classes for their support and self-care. So I think I have some connections there. I'll maybe just start to broach the subject and see, like, has anyone thought about doing this locally?
Yeah. And I think the two big pieces, there's the networking and there's the education. So coming back to that, for anyone that's wanting to get their foot in the door somewhere, networking and educating the why and the what behind it.
Yeah. Awesome. Thank you. I'm very appreciative of you sharing your experience in this.
Thanks so much, Danielle. Thanks for your question.
Thank you so much to Janet and Whitney. I know there is another question from Deborah about billing and reimbursement, and I know that there is reimbursement happening at Skyway just based on previous conversations I've had with you and Jenna. I don't know if you're able to kind of respond to that in the chat, Whitney, or just take a moment to answer that now if that's easier.
I can speak to it very briefly.
Great.
It's just that for my role, I fortunately do not have to directly interact with insurance at all. We have billing specialists that do that. But we are billed under the umbrella of, we're included in the programming for daily PHP IOP. That's what they bill for, a full day or a half day of PHP or a full 3 hours of IOP. I'm not sure if that exactly answers your question, but that's how our billing structure works in a nutshell.
Yeah. So you're not using a unique, well, first of all, you're not doing any billing. I heard that, right? Somebody else that specializes in billing does. And my understanding is that it's part of a bigger bundle. It's not an individual code for yoga therapy.
Correct. So whether a client does one-on-one yoga therapy in our program or not, because there's plenty that don't, they all get billed the same way. Last piece on this, because I do have an eye on the time, is that if the client does take one-on-one yoga therapy with myself or with my supervisor, Jenna, we're the two people that offer one-on-one at our location, that is their second therapy session of the week. Insurance covers 2 individual therapy sessions. So that would otherwise be with the talk therapist. And then if they're a candidate for yoga therapy, they do 1 session with us, 1 talk therapy session, and it's billed the same way.
Mm-hmm. Mm-hmm. Great. Thank you for answering that. Well, thank you, Janet, and thank you, Whitney, so much. Really impressed with what you're doing, and yeah, just really excited to see this work out there in the world. And I know where Whitney works, that Jenna really built that program there. And when they originally went to Skyway to talk about yoga, I don't think they knew what yoga therapy was at Skyway. So it had, it's amazing to me to see how something so comprehensive and now well understood and well integrated came into a place that thought that they just wanted group yoga classes there. That was the original ask, and yet something much more comprehensive was built. So that's just really amazing to see. And I think oncology is one of those areas that is probably more open to yoga therapy than others. So to see the work that Janet's doing can be really great inspiration for other folks who might be wanting to specialize in yoga therapy and oncology and work in a hospital setting too. So thank you so much, you two. And we're going to take a quick break and we'll come back with our final presentation. I'm going to keep the room open.